our rights to longevity and health.
Honorable members, ladies and gentlemen, thank you. Thank you for having me as someone who has had the privilege of addressing both the German and the European Parliament. I really appreciate what honor it is to stand before you today. So thank you for your invitation, and thank you for the work you're doing. And to be frank, even more, thank you for the hard work you and hopefully we all will be doing after this day. So I only have a couple of minutes. So I think in a sentence, but you often heard this Estonian example as a good example for digitalization, but I really think what Estonia did for digitalization could Lithuania do for longevity, or could become Lithuania for longevity. And I would like to explore that, what that actually means and what it actually requires, not in theory, but from this House, from this Parliament, what political choices you would need to take to make that possible. But for me, I would like to start with a personal story a little bit. For me, this discussion is not abstract. My grandmother is 105 years old. In 2 weeks, she actually turns 106. So her life really is a living reminder that healthy aging, longevity, good years, or however you would like to call it, is possible. But it also raises the deeper question before us. So how many more people can reach old age, not merely alive, but with dignity, with independence and health? Because the goal is not simply to add years to life, but we have heard it often today, it's also to have more good years. So that distinction is one of the parts of my talk. So I think the chance to really leapfrog to more healthy years in Lithuania is to learn a little bit from the Estonian example for digitalization, because they did not wait until a crisis really forced its hand on the digital government, excuse me, but they decided early, so actually before the curve, and built the rails, digital identity, X-roads, e-residency, years on. And now it actually leads Europe. We have been there with so many, like every year we're there with a delegation, like trying to learn how they did it. So I think Lithuania can really do the same early decisions now in a different field in more healthy years. So a move from the right to health, more to the right to healthy aging, a right to longevity, really as a national plan, as a national project. So the uncomfortable number you already heard today, and I'm going to skip because the time is already tight, is that the Lithuanian who reaches 65 today can expect barely half as many healthy years as the European average, roughly 5.5, against about 10. So more than half of these years after 65 are lived with activity limitations. And Lithuania is among the 5 EU countries where women lead actually a healthy life much more before the men than in the average. So not all of this, I would actually say maybe none of this, we can discuss male and female longevity later maybe, is a fact of nature. But you have the usual candidates, cardiovascular disease, risk factors. So take this year's policy already knows how to save. So prevention arrives too late, the cost appears as lost healthy lives. So what policy has shaped in the past, policy now also can reshape in a more positive way. So I claim that the right names the duty bearer. So I'm a jurist, so let me be precise here about the word right, because precision is really where this credibility lives. So the right is not an aspiration, the right is not a slogan, it really names the duty bearer. So someone who can be held accountable when it is not met. So the right to health is not new, nor is it soft. No, it's a soft law, it's margins actually. It's recognized in the European Social Charter, Article 35, won't bore you with the details. It's constitutional traditions from all the member states of the European Union. But what changes over time is not the right itself, but what is considered to be normal, reasonable standard of care. So a century ago, antibiotics, miracle, then dialysis, then statins. So each of them became in terms simply what a health system is expected to provide. So longevity science, healthy aging science, is the next step on exactly that path. Today's frontier becomes tomorrow's standard. So when I speak to the right to longevity, I'm not inventing a new entitlement. I'm saying that the existing right of health is already moving into this direction. So, and the duty bearer is the state, the parliament, that sets these priorities. In practice, that means something very concrete, a 5-year mandate, naming 3 to 5 priorities, that a government can be measured against. That is not philosophy, that is something this House can actually do. Let me say clearly what it's not. So unfortunately, no fountain of youth today. I have to disappoint you. I will not claim immortality, but it's a start to just more healthy years. And sorry, let me go back for this. So where the healthy years are hiding, cardiovascular, alcohol, most of these needs actually needs no breakthrough. It just needs earlier screening and sustainable funding. Yes, I will switch to the next slide. So my experience from the German Bundestag actually shows me that prevention almost always loses. So the budget contest to acute care. So not because anyone opposes it, everyone loves prevention, I always say it's a good thing, but because benefits arrive after, unfortunately, after the next election period. So prevention needs a structure that precedes it from the electoral cycle, or it quietly will disappear. So as I already see you approaching, I will speed up even faster. So you see, and I was so happy to see all the ministers here today, because really health in all policies, it needs to be in all policies. It needs to be across the sector, otherwise it will not work out. So let me let me roughly jump to the European policy level. So at the European Parliament actually shows the mirror image. So is it just me hearing it? No, okay, so thank you. So in health, Europe really lacks the ambition, but the competence was shared, and is shared between, and politics is very complicated. So actually it took a horrible, terrible pandemic and a hard lesson that a virus does not stop at a border, and neither does aging. So to move the structures. So only now, I think 2024, 25, for the first time, the Parliament has actually full standing health committee. Before that, it was always a subcommittee. So these ambitions need structure before the next crisis arrive. I think Lithuania does not have to build these from zero. We have EIT Health here, we have European Health Innovation Community here, we have a pan-European network establishing here. So a national hub, I hope, is forming here. So I would really like to encourage you to proceed with this way, and maybe like to directly jump to the ask. So really, from frame to commitment, 4 asks. 1, support a group of parliamentarians for healthy aging and longevity. 2, set a measurable 5-year target. Let me be concrete. Close maybe 1 year of healthy life year gap by 2023. From 5.5 maybe to 6.5 years, and also create one cross-party mechanism that survives the next election. 4, report healthy years gained in this House, the way you report a budget, you know, the work plate number to improve, but a measurable target, and a structure to protect it. If it's not measured, it will not happen, I think. So this is what I would call a health balance sheet, where you really can be held accountable, where the Parliament can be held accountable, where you can hold your governments accountable. So one simple shift, health balance sheet as every measured policy, and every budget, if it's not only by its fiscal cost, but by its effect on healthy life years. I would have loved to speak a little bit more on the WHO program really now for living as which is a new priority, which I think is really, for the first time, really addressing concretely aging as a major factor, and I really would love to see much more member states acting on that. Sometimes governments need help, parliaments can help governments act. So please, if you're engaged politicians, I mean, really kudos to you. You are doing a wonderful job here, and we need to find more parliamentarians across Europe to follow this example. So this is my team. Thank you a lot. If you're in contact, I will be here around here. Thanks a lot.